And Evie, tell me when it says it's live.
It's live.
I'm waiting to see.
Yes.
We are Facebook Live. Hey, yay, we're getting there. Hey, everybody. How's everybody doing? Well, this is another series that we are doing. And I'm going to share this, actually share now, that we're doing. And this episode is on our health. And I wanted to do something for Breast Cancer Awareness Month for October. So we couldn't do it. So I told Evie, who's my producer, my manager, my, and Sharon, they're the ones that actually help me keep me contained. No, Wanda, you can't do this. And Adeline, she said, that's too much, Wanda. You need to slow down. Let's wait till January. So I am actually so excited to do this. But I wanted to make sure, because we missed Breast Cancer Awareness Month, that we actually still do something, right? And I always wanted to have April on, because I really enjoyed. They had the episode playing your cards right. Is that right, Evie?
Yes, that's correct.
Playing your cards right. So I wanted to make sure that we still did, even though it's in November, and actually my birthday is coming up, so it's still special, right? I wanted to make sure that we still had this episode. So Breast Cancer Month is something so dear to all of us, and we want to make sure that we are taking care of ourselves. So being healthy, and I'm admitting a lot of people in here, so forgive me. So we're growing here. I want to make sure that we all still stay cognizant of our health, and also the screenings and breast cancer survivors, which is Patricia. She's one of them. And I just want to say, may God continue to heal you, and for those who are suffering with breast cancer, to make sure that you're doing the healing, because now this is the most stressful time that we're dealing with with the election, with the COVID. It's just so many things that we're dealing with, right? So this is special to me, and I told Evie we still got to have it. When can we have it? We didn't want to rush it because I had a convention at the end of October. So I am so honored to have this special guest with us, which is Evie Fleming and April Liverman. And Evie is my yoga instructor as well as my reflexology instructor. So Evie is currently working as a reflexology and has her 200-hour certification in yoga. Yay, Evie! She also is a licensed practice nurse with 20 years experience, which gives her many files to choose from when working with her clients and gaining awareness about her health and well-being. And I know, Evie, you're also a nurse, right?
Yes, yes.
She also, she's a jack of all trades. So without further ado, I would like to introduce you to Evie Fleming. And we're going to put her on the speaker view. Okay, Evie. Put yourself on speaker view.
I'm assuming I can do that. Am I on speaker view now? Is that how that works? Okay.
Yeah. As soon as you talk, you're on speaker view. There you go.
Well, the first thing I guess that I would like to talk to you guys about is if I think about how did I get to where I am? It's probably a question that comes up, like how did I always know I wanted to be in the area of health? And I can say yes, because my mom and my sister probably both will remember when we were in the house, we would always, my mom she worked at a hospital, and sometimes we had like bogus files and stuff that she had, and we would use those files and pretend like we had little hospital settings and set up files, and our bedrooms were different rooms, and we would play hospital and school and have classrooms and stuff within the house. And we always were very good about occupying ourselves at home. And so I think that it is a testament to say that when your soul comes to this world, you have already defined and probably start gravitating toward the things that that bring you joy, and that in a sense is your purpose and your mission. And so I think it was a journey that started before I even went to school, and then I went into the area of nursing, and I loved nursing. I mean, it was like second nature. And I finally moved into the area of home health care, which I think for sure helps me a lot in my practice now, because when you're in someone's home, you can see what they do and their daily activities, and you're like becoming an outside observer in a way, and can give them offerings of different things to do that they may not actually be recognizing. And so in doing all my nursing, then I finally moved to a space of where I was like starting to care for myself. And this is how I went to the gym, like everyone always does. Like, you know, you have those New Year's resolutions and you go to the gym and you're like, okay, I'm going to go and do these things. And then you start to work on stuff and work through things. And so I found yoga in that way. I tried all of the aerobic stuff, and then I discovered yoga, and I fell in love with it. And I actually had a teacher whose class I took several times, and she walked up to me one day in the locker room and said, "You need to teach. You know, there are students who are students, but then there are students who are teachers, and you're a teacher, and you really need to teach." And then from there, I took off to teaching. And then in the next phase of that was just, now how can I take my career as a nurse and move it into something that still gives a little bit of a more natural movement to people and natural things that they can do. And so then, of course, I discovered, you know, reflexology, which I love. And I love that. I think they all tie in together, you know. And the way that they tie in together is that it's all about body awareness. Like, are we aware of our bodies? Are we aware of our different movements? Wanda has taken yoga classes with me, and the first thing I do is make people, it's like quiet time. We have to get right into our bodies first, and then clear all the mind chatter. And so you can see the tie-in for that, because even with nursing, if you're going in a room, the thing that you as the nurse would want to do is get quiet so you can hear what the patient is saying, what the client is saying. You have to get out of your own mind game so you can actually get a panoramic view for, like, what did they come for? What is the thing that I can hear that's speaking the loudest, and they may not be saying it. And so that happens in yoga, that happens in reflexology, because you're listening for the other person, and you're actually then developing their own listening, because then you're giving them clues about, okay, when you stand this way, what do you experience? When you stand in a mountain pose and I tell you to lift your toes and then you press your toes down, can you feel the difference in your body? When you're stretching your arms outward, are you just letting them hang there? Are you mainly in it? And if you checked out for a moment, where did you go? Like, where did you go? And not in a bad way, but like, oh, that's interesting. Does that happen often when you're trying to sit still or hold in a moment? Do you go off and then not, in a sense, come back? And what are those distractions and stuff? And so I think they all work in together, because we are dealing with the body and we're dealing with awareness. And so,
you know, I was supposed to ask you that question too, Eddie. I was supposed to ask you.
Went
So
right on.
I was supposed to ask you, so what made you get into nursing and work in the area of health and wellness? You just told us that. So thank you very much. So my next, and you told about how your childhood is. And I said, oh, I was supposed to ask her that question. I'm sorry. So the next question is, so what you do, and I want to really interject this really, because when COVID happened, I was doing my yoga, my dance exercise at Kaiser. April, look, I'm a member at Kaiser. I was actually doing that, and I really enjoyed my classes. So when COVID happened, I couldn't go anymore. So I won a prize from Evie, and it was for the yoga. So she said, "Oh, and I told her, now I'm her manager now." I said, "You need to do this virtually. You need to do yoga virtually." And I know I kind of slacked back a little bit because I've been so busy, but I'm coming back, Evie. I promise I'm coming back. So she actually helped me. But whenever I have an issue with the cramping of my toes, I text Evie. I call Evie. I say, "Evie, what do I need to do with this?" And she tells me. So she is such a wealth of knowledge. And I just wanted to interject that to let you know. So my second question to you, what do you so what do you think ties all of these things together?
Well, for sure, it's like it's a lot of it is the mental tightness of it, because and you having body awareness, because if as a nurse, you have to have awareness, because you're going to get asked questions like, well, how long have you been having that pain? Is it sharp? Is it dull? Does it come on with this? Like, if you're not in awareness of those things, then you can't go from A to B. You're trying to figure out which direction you want to go in. And so the tie-in too in the yoga is, when I move somebody in a particular motion, then I can say, how does that feel? Tell me where you feel it. Then it can help me to zero in on where they need to stretch or where they're having the pain, because, oh, when I do this, it feels this. Then we can locate it. And the same is true with reflexology, because if someone tells me they're experiencing something, then I'm going to home in on that area on their feet, and then see if we can move the energy in the body in that direction, because we're both setting in all of it. It's awareness and intention. You're setting an intention for something to move in a particular way. And the mind and the awareness is key. And that's how they all kind of tie together. And they're all about self-care.
Absolutely. And that's really what it's all about. Self-care, right? And we as women, and and men, we need to have self-care for ourselves. And that's so important. But how many times do we do that? I know, like I said, I've been tied to this election. I've been it's intriguing me, with everything. So that's been stressing me out. And I have to step back and take a deep breath. That's why I love my friend Abby, because she goes into those breathing exercises, and it just relaxes me. So let me go on to the third question. So in this year, you had to pivot, like we all did. I mean, I know I had to pick. Look what I did. I rebranded myself, WD Pearson Associate, right? So we had to pivot. What can I do now and you just got your shop, Abby? You just opened up your location, right? And COVID happened. COVID messed up a lot of things. But
Yes.
it really helped in a lot of ways, right? It helped us to think about other ways that we can do our business. And that's what's so important. So how can we do this in business? So what became your new mantra this year is we had to chance that and actually chance our business. What made you do something else? What made you? And then I'm going to finish. I do want to give April's bio. So before you introduce her, I want to do her bio.
Okay. Well, the thing that I think what happened with what became like my new mantra, or like my new, charging orders in a sense, this year, was to I did have to shift, because and part of what I think happened actually became a little bit of a guideline of how to then direct my energy with my clients and direct what they're doing, because all of a sudden now we had to establish new routines, right? We had a certain routine, and we couldn't do that routine, and then the system is already fighting and against already. It's in that sense. And so in our minds we have like these tallies of things that we wanted to do. I was telling my sister, I said, you know, I got on to different networking things, and you hear people, well, what are your priorities? And they would say what I hold sacred, then they would say family, then they would say job, and nowhere in there would they say self-care. You know, like it was, they were ticking all of these things. And I realized that my mantra and my mission during this time was to try to figure out how I can get people to intermingle in between those layers a sense of self-care and self-awareness in a way so that we prioritize stuff. Because a lot of what happens is we were starting to go into the they thing, like they closed the gym, so now I can't work out, or they closed the store where I got the certain food, so now I can't eat that. They. And it's like, no, it's I. Like, what am I going to do about like what's happening? Like, I'm responsible for my health. I'm in charge of my thoughts, right? I'm in charge of what I eat. I'm in charge of what I put on my body, what I do. Like that sense, if anything, I want to relay to women that piece, because that is actually you claiming yourself and that you're right to be here. When you stop with the they and stop being outer referent and you're more inner referent and say, I am responsible for my health. So if I know I need to exercise more, then if I can't get out to the gym, then I'm going to call Evie. Where's that virtual yoga? Like, what are you doing? Like, what's going on with this? If I'm having an issue with de-stressing or I can't relax, oh, wow, there are services that I can take advantage of that will help me to take my mind offline for a minute and help me to deal with some of the things I'm doing. Because in actuality, if we change our mindset around stuff, then all of the other things that we want will gravitate to us because we're projecting a different energy. Like you, how many times have you been in a room and a particular woman walks in the room and you can almost feel her walk in, that they have this statement, this ownership of themselves, and it exudes from them, and then people gravitate to them. And so I'm hoping that through my yoga and through my reflexology, and then even with my jewelry, that I make women more aware, or people, anyone in general, aware of their bodies and having love for their bodies and a lot of self-care, you know?
Mm-hmm. Wow. That's deep. That is so true. That is so true. That's why I tell you, I'm so glad that I met you, and you know, to keep us grounded, because she, you know, Sharon, though, she always has that calming voice. You know, it's just like, God, I wish I could be more relaxed.
I know, it's like one of the things. Wait a minute,
yeah.
What happened? Let's sit down for a minute.
I wish I had that. And my daughters know. They know me. They're like, you know. So, and I'm a Scorpio, so sometimes, you know, that Scorpio comes out. So,
it's the
you know. So, but no, that's excellent. That's really great. So I really appreciate you sharing that. And not only that, with the self-care, with and I don't know, April, if you want me to say your bio, or you're going to say your bio, but I just want to introduce you as far as Evie and April and some other friends of theirs did Play Your Cards Right. That's why we named it Play Your Cards Right. To really do more on the self-care and actually your health and you know, but I really enjoyed what April was saying, and that's why I told Evie we gotta have April on my show. I mean, I said I want to be like the mini Oprah. I just want to bring everybody on. I want to introduce everybody. So at the end, I'm going to tell you the other stuff that I'm doing. But without further ado, I don't know, Evie, you want to introduce your sister, or you want to, you know, bring?
No, you do it.
But without further ado, I want to introduce April. Now, April, do you want me to tell your bio, or you want to tell your bio?
Go ahead.
Okay, well, it's so intriguing, I tell you. So April has been board certified a physician assistant since 1996. Wow. Now, you know she's experienced, right?
Oh.
She has worked in family medicine for 11 years in Columbia, South Carolina, and in breast health in Georgia for 13 years. She is also certified as a breast sonographer by the American Registry for Diagnostics Medical Sonography. She is also a vice president on the board for Outdone for Ovarian Cancer, a nonprofit organization supporting women diagnosed with ovarian cancer. Without further ado, I would like to introduce my guest, April.
Hi, everybody. Thank you so much. I'm so excited to be a part of this. This is the first time I've ever done Facebook Live, but just to be able to, get in front of women and get some information out to the women. And Evie was talking about self-care and self-help. And I think it's really important. I always knew that I wanted to, help people in some capacity. And at first I thought I wanted to be a teacher. And then as I got further in my education, like in high school, I realized that I liked medicine. And partly following my sister, because I wanted to do everything my sister was doing. So she went to the College of Charleston. Now I need to go to the College of Charleston. So I was sort of following her footsteps. And after I finished college, I did go into nursing school. But one of my cousins said, I think you should do something beyond nursing school. I think you should maybe consider being a mid-level or a PA. And she told me about a program that was in Georgia at Emory. And as I was pursuing that, I found out that there was a program in South Carolina. And because I was a resident of South Carolina, it was better financially to go in-state. And so I applied and I got accepted, and there were only 26 students in the class. So, I was very fortunate to get accepted. And it's just been so rewarding. It's just like, I'm not a morning person, so I do not like getting up in the morning. But when I get to work, it's just so natural and I love it so much. It's just, I always tell my family members and friends, like, I love my job. And one of the things that I want to talk about tonight is, I'm also aware of what it feels like to be on the other side, like when you're the patient. And I always found that when you're in that situation, you feel so vulnerable when you go into a room with a provider. And so I'm always trying to make, my patients feel relaxed. So I walk in the room and I'm always smiling. And sometimes when I walk in and I'm like, hi, it's almost like I know them. And they look at me like, okay, she's happy. She's happy. And then I sit down, face to face with them. I don't stand over them. And sometimes I will say, like, tell me something about yourself. And they'll look at me like, oh, wow, like she really, like she wants to know me, like as a person. And or I'll say, you were referred here and I would like to hear, in your own words why you're here today. And then it makes them feel comfortable, because I think that's important as a provider to do that. Not all providers are people, are very personable. And I know what it feels like to be on the other side, but I want to make the person feel comfortable to be able to give me the information I need to be able to help them. So I try to approach it that way. Sometimes I can tell, sometimes I walk in a room and because people think I'm younger, they look at me like, and sometimes they ask me like, how long have you been doing this? And I'm like, I've been doing this a long time, And then when I say 96, they're like, oh, okay, well, yeah, she has been doing this a long time. And but I just want to encourage women, when you go in a doctor's office, the providers, you pay their salaries. So you're going to get a service. So don't feel intimidated like you can't ask for the things that you want to get out of the visit. It's really important for you to speak up for yourself, and it's important for you to be very aware before you come into the appointment of the things that you would like to ask. Even if you have to write it down, just so that you won't forget. And so I try to, fortunately where I work, I don't have to rush through the visit. So I can take time with my patients, which I enjoy. And that's really helpful to be able to give people time to be able to get the information to you so you can help them.
Yeah. I want to ask you a question, because that is so true. When I go and get my mammogram, and I wanted to ask you, what age should women start getting their mammograms? I know I started with mine when I was in my 20s.
Right. So There are a lot of recommendations for when you should start the mammogram, but I will tell you that most providers will go by some of the national recommendations, which are starting at age 40. But that being said, there are people that who may need mammograms before age 40, and it depends on your family history. It depends on if you've had a problem with your breast before where it needs to be evaluated. Maybe you've had a lump before, maybe you've had a biopsy before. So those things and other factors can determine if you need a mammogram before age 40. We don't encourage members who are not at risk for breast cancer to have mammograms really early and do that for years and years, because there is some radiation exposure. And when you start having mammograms in your 20s and you're doing them every year when you really may not even need them, we don't try to encourage you to do that if you don't need it. But it's going to be based on, your history, your family history, and other different things to consider before recommending when a person should have a mammogram.
Yeah, that is so true, because the reason why I started in my 20s, because my mom, she actually had breast cancer.
Oh, okay.
And hers was she didn't even have a lump. It was just a spot.
Right.
So they removed her breast, and thank God she got through it. But also my grandmother had it. But when my mom went to see her doctor, who actually was telling her, he said his daughter was 25 years old that had breast cancer. Yeah. So that's why I started doing mine in my 20s. But my sister has breast cancer, one of my sisters, and she's going through that. And I was really trying to get her on this webinar, but I'm hoping she see the Facebook Live. So, but I didn't want to, but without further ado, I just want to say, what is the significance of knowing your breast density?
Okay. So breast density is like a new thing that the radiologists are having to report on your give to the patient on the report. Before, we would always see what type of breast tissue, as far as density, what category you fall into, but the patient wasn't given the information on the report. So now the American College of Radiology is actually, they have guidelines where you have to tell the patient what category of breast density they have. So the category is from category A to category D. So A is fatty replace, so less dense, and D would be extremely dense. And the reason why that's important is because if your breast tissue is extremely dense, that's where the difficulty in reading the mammogram comes in. So the way I try to explain it to people is that if you were outside and there were stars in the sky and it was a cloudy night, you wouldn't really be able to see the stars very well. Versus if it's a clear night, you can see the stars very clearly. Mammograms are very similar to that because the clouds or the density can obscure a mass and make it hard for the radiologist to read the mammogram. And they report that they will actually give that in the report telling you your breasts are extremely dense. You may want to consider, additional screening methods. And then also sometimes when your breasts are really dense, particularly when you're young, that's one of the reasons why it's not so beneficial to start having mammograms before age 40, because it can be extremely hard to read the mammogram because so many things are going on hormonally. But I can tell you that you need to make sure that you give your provider all your information. When people come into where I work, we ask them to bring previous films for comparison, but all the information that you can give your doctor in regards to your family history and personal history will help them to evaluate you and determine what you need specifically for you.
Yeah, and that's true. So what is the importance of having your provider check your breasts?
Okay, so clinical breast exams, I want to stress that. So there was a period when providers were trying to encourage people to do self-breast exams. People got so nervous about, I feel a lump here, I feel a lump there.
Yeah.
People would examine their breasts at the wrong time. So the breast exam, if you're not in menopause, you should examine your breasts 10 to 14 days after the start of your period. because your breast will feel very lumpy right before your period. And you may feel a bunch of lumps. And then as your period starts and you get further into your period, you may not feel the same lumps. But that being said, so they stopped encouraging women to do self breast exams, and some people still don't encourage you to do it. I personally think that you probably know your body better than anybody. I mean, there are some people, their husbands know their body better than they do. And they come in because they say their husband felt this. I mean, I've had people say their cat found it. So
the cat, okay.
The cat was nipping at this area. I guess cancer, the cat could smell the cancer. I've had people say that. And they were cancer. But a clinical breast exam means an examination by your provider. So first of all, you need to feel comfortable and confident that your provider is doing a good breast exam. And if you don't feel that way, you should find a provider that does. And the reason why I say that is because sometimes things that we think are normal, and that happens a lot, a provider that's doing a breast exam on a regular basis can actually discern whether this is something that needs to be further evaluated further versus you checking your breast. And then some people are just not comfortable with it. They say, you know, I feel lumps. I don't know what the lumps feel like. And so you should have a clinical breast exam. And another reason to have a clinical breast exam is, I'll give you an example. I had a patient that had a lump. She went for a mammogram and an ultrasound, and she had a lump in her breast. And the radiologist did the mammogram and ultrasound. They said this particular lump looks like a fibroadenoma, which is a benign lump in the breast. And so she came to me for a breast exam. And when she came to me for a breast exam, number one, she gave me a good history. She said that she noticed the lump came up in 3 months. So no benign lump comes up in 3 months. The second thing was, when I went to examine her breast, I could not move the lump. The lump was fixed. It wasn't movable. And I said to her, I would suggest that you have a biopsy. She had a biopsy that day, and it turned out that it was a cancer. So going in to see a clinician for something that you're not sure about, you know, it would be better for them to give you a professional opinion than for you to just ignore it and, you know, hope that it goes away, or say, oh, my mammogram was normal and the radiologist said everything was good, so I don't have to go in for a clinical breast exam. Especially like now during COVID, when I'm talking to my patients, if they have a normal mammogram and ultrasound, but they're saying that they felt a lump, I always encourage them to. And I wanted to say one last thing about the breast exam. If you feel a lump in your breast, when the radiologist tells you they don't see anything, that doesn't mean that there's nothing there. That doesn't discount the fact that you felt a lump. You did feel a lump. You need to know what the lump is. And so I try to show patients on ultrasound, on exam, tell them what this lump is. It doesn't mean the lump you felt is not there. You know, I feel, when they say they feel a lump, if I feel it, I will say, yes, this is a lump, and I'll tell you what this lump is. So sometimes they'll say, well, the radiologist said they didn't see anything. Yes, they did see something. They saw something benign.
Yeah, you know, and that happened to me. I didn't feel it, but when I went for my annual mammogram, they did an ultrasound. Right. And when they called, they said, oh, everything should be okay. Well, I didn't hear from them until my doctor called for 2 weeks. I said, everything's fine. You know, everything's fine. So it ended up that I did have to do an ultrasound. I had to do a biopsy. So just like what you said, April, as far as having that second opinion and going there, and thank God it was benign. Right. It's like you're saying. But also, you know, you have that fatty tissue, because I have that fatty tissue, and I always like, why is that lumpy under my arm? Right. And they told me that, so because that always was just scared, because I've had it seemed like most of my life, you know, with that. So that is so true. So yeah, so the last question, but I do want to ask, so you did talk about you want to talk the high risk. How do you know if you are at high risk for breast cancer? Okay, so I did, I'm gonna put in the chat box a calculator that's actually online, and it's I'm gonna type it in and put it in for you guys to look at. But
It's a calculator, and it asks you various questions. It asks your age, your weight, your height, information about your family history, about your personal history, if you've had any biopsies, your breast density, if you know it. And we use this calculator to determine if you're high risk. So typically, I will tell you, because I do it often, if you have a family member that is 45 years of age or younger, that has had breast cancer, your risk is going to increase significantly just based.
Wow.
Other things that will also increase it will be your breast density. If you've had biopsies before that were abnormal, if you've had somebody in the family that's had ovarian cancer, and if you've had a male person who had breast cancer in the family, and then obviously if a person is tested positive for a gene mutation, which puts you, you know, at a very high risk, especially if you test with a gene mutation.
Wow, that's interesting. So yeah, Sharon was saying a friend of hers had inherited a cat that bit her on the breast and would not heal. That's when she finally found the doctor cancer was found in that area,
Wow.
the cat that had bitten her. So that's something. I am going to open it up for questions too. But I want to ask another question. Do men also get breast cancer?
Yes, men get breast cancer, and obviously they don't get it as often as women do, or you hear more about it. But men do get breast cancer, and one thing I could say about male breast cancer is that, of course, it's not as prevalent as female breast cancer, but men typically, if they feel a lump, they're coming because they don't have lumpy breast tissue, so they will come in for an examination if they have a lump, even if it's not breast cancer. But because men do not make as much estrogen as we do, that's partly the reason why they don't get breast cancer as often, because a lot of cancers are very sensitive to estrogen. And so that estrogen feeds the cancer. And so since they're not making a lot of estrogen, that lowers their risk for breast cancer. But men do get breast cancer. I can say that we don't see it often at all. We don't see it often at all. But men do get breast cancer.
Yeah, I know. Years ago, I used to hear about that as far as men getting breast cancer as well. So that's good to know. In case some of the men on Facebook are watching, make sure you check your breasts because some of them is bigger than a woman's breast. So anyway, so yeah, make sure you check your breasts with that.
Right.
But I wanted to, I didn't know if you want, but I wanted to open up for questions. If anybody had any questions to you, April, because you have given so much great information. But anyone have any questions for April? And I know some of the people, Patricia, why don't you and Sharon share your what happened with you guys if you can, just so that people know it can happen to anybody, you know?
April, I just had a question for you regarding the 3D mammogram. For the last 3 years, that's what I've been doing because of density. Is that your recommendation?
Well, 3D mammogram is, it can be more specific because if you think about it, the mammograms that we have now are digital for most facilities. 3D mammograms, people are trying to incorporate that into their practice, but mammograms that are digital are 2D. So basically, it's like if I put my hands up this way and I put my hands up that way. So you're getting 2 dimensions. 3D would be like me,
right? Different views,
and you could get the whole view of my hand. You could get the whole view. So of course they can be more specific about locating where something is if it's abnormal, and plus because of the breast density, you can see the breast at different angles, which is helpful. So yeah, 3D mammograms are recommended, but it's not always available everywhere. Yeah.
That's how I found out about the cyst was because of the 3D.
Yeah.
So I know they're doing that now, which actually is more in depth to tell you because you don't know.
Right.
Anybody else have any questions? Patricia, you want to say something?
Well, I know that I was diagnosed with cancer whenever I was 20, and then I was later diagnosed again whenever I was 23. I actually have an amputation. The cancer I had was so rare that they really didn't know what to do because the five men before me all died. I had osteosarcoma, osteocyganate, and this very long ADA, a very long word. I was the first woman to ever have it, and I'm the only survivor.
Wow.
And I'm in 2 medical books. And how I even found out about the tumor that I had in my leg when I was first diagnosed, I used to go for a walk a mile with my mom when I was going to college. And I had a red area whenever I took a hot shower. And so I suggest that whenever you take a shower and just examine your body, get used to your body. If you see any redness anywhere, have it checked out because you never know. And if I didn't bring it up, I would have been dead within 6 months.
Wow. Wow. Thank you for sharing that.
Yeah, thank you for that.
It's
so
ended up
very
losing.
true.
I lost my leg when I was 21.
Oh,
Wow.
Yeah.
Wow.
And then I was later diagnosed again in 2001. And I had lung cancer then. And my grandmother had, she had started out with cancer in her uterus. And she went to take it out, and they didn't take out the ovary, and she ended up getting it in her kidneys and her blood. We were diagnosed at the same time, so we went through it together.
God.
So my advice, whenever you go to doctor's appointments, make a list of all your concerns, all your questions, the medications that you've heard about or you've researched. Ask them questions, because like they said just a few minutes ago, they don't mind you actually asking questions, because if you actually do some research, it helps them do their job, because that way they can help comfort you and give you advice.
yes.
And so my advice to everyone is to make a checklist before you go to the doctor.
Mm-hmm.
And y'all did very well. You gave a lot of information. Thank you so much.
Well, thank you for sharing. Yeah, because
Yes.
Wanda, I had when April was talking about examining your breasts and also to go and have that. I mean, I think that that is key to knowing your body, and which is why I say I want women to be familiar with their bodies, love their bodies, because the lump that I had in my breast, I found it myself. And I was the person who discovered it, and it was exactly that, like. Me moving around and being like, oh, wait a minute, that doesn't feel like that's supposed to be there. But if I didn't have enough comfort in checking myself or have myself on a checklist of I notice where I am, I have awareness of where I am, then I may not have noticed it. And I mean, it did turn out to be nothing, and I had it removed, but it was that thing that said, okay, I need to check my body. It's not outside, it's me taking charge of myself,
That's great to know, because I tell you, I don't, and I know I need to do it more, self-check, but mine, it was so tiny. It was that tiny that I wouldn't, if that 3D did not catch it, I would have never known. And I'm just so thankful. You know what the hardest part though, April and Evie and everyone is waiting to hear the results. Like, okay, what, you don't hear anything, you don't know. And then finally, when they called me and I went in, the doctor said, oh, you don't have to come in. No, you're benign. What, thank you very much. I mean, I've been sitting here for 2 weeks wondering, what's the result? So
I know the waiting part actually is crazy, because that's why you have to be like, not be afraid of it, like to step into the fear a little bit, because April will tell you the earlier things are detected, the better they can jump on top of things. And
Absolutely.
So that's the thing of, if I'm not in awareness of my body, I don't do the stuff daily or weekly that I move my system so I know how I'm moving, or know that I'm not moving in the right way. Just as she said, I don't have a checklist to bring them because I have no self-awareness. So I'm not sure what's going on.
That's great. Well, I have a question for April on here from Pamela Bird. Hey, Pam. What are the most common precautions we can take to minimize breast cancer other than breast exams?
Okay. Well, then we want to look at risk factors. And I want to mention this one first, because some people don't even realize it, but obesity, being over your ideal weight, you don't realize that, number one, you're increasing your estrogen production. So if you develop a cancer that likes estrogen, you have plenty of it, because if you're over your ideal weight, that will put you at risk. Not only that, the thing I think that breaks a lot of our hearts is when a person comes and they discover that they have breast cancer and they're over the ideal weight to get reconstruction, and the plastic surgeons turn them down because they know that women that are overweight don't heal well. And some plastic surgeons will refuse to do reconstruction. And that can be devastating to a 35-year-old woman that has to have a mastectomy and she can't get reconstruction. So those are things to consider with being over your ideal weight. The other thing is, of course, smoking, which it always surprises me that people still smoke. I just think it's like, I get so surprised when I see people smoking. It seems like such a thing of the past. And, my mom can tell you how I would terrorize her friends when she was quitting smoking. I would be like, you cannot smoke around my mom. My mom quit smoking. No. So smoking, of course, you don't want to do. Other things would be, lifestyle things like excessive drinking. Alcoholism can increase your risk for breast cancer. If you're having more 3 to 4 mixed drinks, in a weekend, you have to think about things like that. All those things increase your risk. Eat processed foods, unhealthy foods. You want to put good things in your body. You have to be careful about things that have excessive hormones in them. And so you want to make sure that you're, watching the type of, things that you're putting in your body that may not even be food. Other things that people take, supplements, with supplements, you have to be careful. And some will have on the labels that if you've had breast cancer, you can't take this. So be careful with supplements, but also keeping down stress. I mean, I've had some people that came into my office and said, yeah, I got this breast cancer because I was under stress. And I think what happens in your body is that sometimes everyone may have some cells that can potentially become cancerous, but something triggers it. And it could be something that lowers your immune system to fight it off. And stress can do that. So, being stressed out and not getting enough rest, those things can contribute to your body maybe manifesting high blood pressure or breast cancer, or a lot of different things can be avoided if you don't stress. And the other thing is stressing about, with the breast. Sometimes I get patients that come in and they are really stressed out about worrying if they're going to get breast cancer. And I'm like, you can't worry every day about something. You worry about something for 20 years and you never get breast cancer. You spend all that time worrying about it. That's not helpful at all. It's best if you find somebody that can make you feel very comfortable with how they're taking care of you. And then I think that will ease the stress. So that's exactly what I try to do. I try to ease the stress by making people feel really comfortable that they can ask me any question. They can email me. I call them to check on them. They can come in for something that they feel, so I can get them comfortable with what feels normal and what doesn't, so that they can, be more educated to take care of their bodies.
Wow, that's great. That's great tips that you just gave, April, and I truly appreciate it. Now, did you put your information in the chat, or even like on Facebook? Just
oh yeah,
because you gave some great information, and this is just really part one. Because we need this. We need education and educating, as far as your health, your wellness, your self-care. That is so important. And I'm going to ask, did anybody else have any questions here? Okay, and Sharon did. I saw Pamela asks, supplements geared towards increasing your immunity are good though, correct? So if you're taking supplements, April, because I know I take a lot of them.
This depends on what supplements you're taking. I mean, the regular vitamins are good, or vitamin D3 is very good to take. Vitamin D important for a lot of things. So if you take vitamin D3, it should be only like 1,000 milligrams, which is a little pearl, unless you've been told that your vitamin D3 is low. Then the doctor will put you on a bolus of it. But I'll tell you a story about supplements. I took some supplements one time for this lady told me that it was helpful to get rid of uterine fibroids. And I went in to get my lab work, and my doctor said your liver functions are 3 times normal. What's going on?
Wow.
And I couldn't think of, I'm like, I don't drink alcohol like that. I don't take Tylenol. What is it?
Yeah.
I thought about those. And sure enough, I looked them up on the internet, and it said can damage your liver if you're taking excessively. I don't know. Some people have a sensitive liver, but you need to do your research. Don't trust everything.
And that's so true, because I take extra vitamin D, because I have a deficiency in vitamin D and a deficiency in calcium. So I do take that extra and that fish oil. So I'm a vitamin person. My kids say, you take too many vitamins. Well, I wouldn't be almost 63 years old if I didn't take care of myself,
Yeah. I mean, for sure, the vitamin, the taking them is good. I'm glad she brought up the thing about the liver, because she and I have had those conversations all the time about supplements and enzymes, and that when you get your checklist back from the doctor, like, are you reading those numbers and very aware of those numbers, and knowing that taking the supplements, I can take all these supplements, but if I didn't drink any water and I didn't move around, then my liver and my kidneys are working overtime to process them. So that can set up the stress in the body as well. So
true.
Yes.
Because I do blood work every 3 months. My doctor had me there, and they know the supplements I take, that's within the medication, because I do have high cholesterol. That's unfortunately, my father gave that to me. I have that bad gene. So I do take that. So I have to do my blood work every 3 months with that. But with the vitamins, and I'm going into the oils, I mean, I tell every lemongrass oil that I put on my feet and my legs and my lotions every morning, that actually helped reduce my my cholesterol. I'm still on the medication, but actually the doctor said, what are you using? Because she's going down. So I believe in my essential oils, making sure that I take care of myself and my body. So
it's good to try natural stuff as well. I mean, that's why I said natural. I know. I think that's why the whole I think the introduction of reflexology, Reiki, yoga, it's all of those things of trying to not get us away from the place of where we think a pill can cure everything. Like that the pill is the way to do it. That we long ago we didn't have pills. We went out, they moved from place to place, and they ate seasonally, and there was a lot more of interacting with your environment. And so I'm hoping that in all of this where we've been so sequestered in, it has made our flashlight a little brighter on our health habits, on what we're doing, because now we were in the house 24/7 with ourselves, and we got to see all of our crazy habits and different things that we had, and like, how can we make adjustments and come away from this with a lot more of wellness, right, on all levels.
Absolutely. And that's so true. And I am so glad I had you, Evie, to help me with my craziness, because I was sitting at Zooms. I was getting tired of Zoom. And having Evie with the yoga, I said, I got to get back into my dance side. So now with my daughter, you probably saw on our Facebook page, we celebrated my husband's birthday, and we did.
I saw it.
Let's Dance Kids. So on my birthday, I'm taking that to their house, and we're going to do the same thing. So that's how we get our exercise, because the 3-year-old and actually the 8-month-old too, make us dance, right? So, and grandkids don't make you dance. They keep you young. But I just want to, so if and I'm going to actually end it, but I want to see if April, make sure that she put in the chat, if you go to caretakersheart.com, that's how you can get in touch with her as well. So we're going to have more of this. This is just a little teaser, right, April and Evie? Next we're gonna have Evie do her breathing.
Yeah. Well, Well, I do want to say that April and I are planning that we definitely will come on and do some more little tidbits and informational things. And then in January, she and I are trying to do another one of our conferences, the Play Your Right,
Yes.
Your Cards Right, where we will, that way we can have a lot of roundtable discussions about things. Because sometimes when we're on a live event, we're not going to ask a lot of sensitive stuff, but
Right.
that way we can get an arena to talk about stuff and maybe show more examples, and then have some body movements that people, that I can show body movements and ways of different, that you can take them into your daily living. So look out for us in January. We're going to do something, and we're going to figure it out,
Yes.
COVID and no COVID. If we have to do it virtually and then have some people be with us 6 feet apart, we'll figure that out. So
Absolutely. I highly recommend that, because I did go to Playing Your Cards Right. And I love it, because I was like, playing your cards right. That got my attention, right? But I mean, the wealth of knowledge from these ladies that I got along with their friends was it was well worth it. Really, it's well worth it, and it really actually helped you to start thinking about things, especially when you talk about the uterus. And like I had a hysterectomy. I don't know if that affects you as far as your hormones, but I mean, I know it does.
it does.
But I really highly suggest when they do have that in January, I definitely keep it posted. I always put stuff on my Facebook page to do that. But this is part of the series that I'm doing. Like I said, I do entrepreneurs, but what God gave me the vision to do was to do this, but to continue that collaboration of sharing entrepreneurs' business. Now, April have her business, caretakersheart.com, right? Evie have hers, treeevolution.com. I have mine, WD Pearson Associates. Well, not LLC. I have mine. So this is what I want to do. I want to bring more people together, because in these times, COVID, we got to start sharing that valuable information on health issues, right? Health issues, small business, cybersecurity, financial, and much more. So I'm going to be having a lot more webinars. Just look out for my webinars that I'm coming up. But also just want to let you know I'm going to be coming out with my book collaboration, as far as, all of this stuff that they just talked about struggles. We have struggles, and mental health is another big thing, right? So mental health, especially during this time, and people say, oh, I got to stay in another 6 months. Well, this is when you got to pivot. And we all pivoted. We pivoted to do what we're doing now. And that's so important as far as that, like even with Patricia, me getting into my girlfriend, Sharon Cooper, that got me into the prison ministry. But God had kept telling me last year, he told me I should get into it. And I said, okay, but I got busy. But then COVID set me down. I said, okay, I really got it. Then I had 2 messages from God, 2 messengers, that was Sharon, and also the lady who started, Pamela Hillman, to get into being a mentor for women in prison. They're going through a lot, and it's a Christian base. So I got into doing that. So, I'm doing my mentoring middle school. So these are different things, part of my community that I'm doing. But I just want to let you know that we are here to support everybody. And if anybody have questions, and come and join Evie's virtual yoga. She wasn't going to do it, but I said, Evie, you got to do this. You got to do it.
Yes. Thank you.
Yeah.
I know. It's
Yeah,
good.
but no, it really is something great that we all need to do, and just think about what we're doing here. And I really enjoyed this. I'm sure everybody else did here, but I thank you, April and Evie. And like I said, this is the first of our health care, and we're going to have essential oils and stuff. I'm trying to put groups of people together that actually goes with it, everything that I think is very good to do. So, all right. So anybody else have any questions? Any last minute things you want to say, Evie and April?
I don't. I just want to, I guess my thing that I would say in parting is, my dog's following me because he's like, it's dinner time, Mom. But is to make sure, I'm always stressing it, like hydrate, and get some sleep. And lastly, if you have a personal calendar, please pencil yourself in. Put yourself on your calendar.
Yeah. You are so right. You are so right. So Patricia put it in lifechangeslegacy.org. That's where you can go on if you want to mentor. And I have that information too. But it really is good. Women need help too. Then this is really a great thing. And I've been getting, I'm emailing. It's an email that you do with your mentee. And I was so impressed. I mean, you get the profile of that person. That's the lady that's impressed. They're doing the men too. But I was so impressed when this young girl came back and told me how she's studying the Bible, how she's going to college. And I was like, wow, that's something. So this is something that really is, that we can think about getting into. But yeah, check that out. But thank you all so much. I appreciate you. I think we did good. And any questions, just come on back and, answer the question. But it's going to be on Facebook Live. Share it. Share the information as well. Okay. So it is on my page. And it's probably, I don't know, I did the watch party. So.
Yeah, I watched video. I can see us on the Facebook at the same time.
Yeah.
April and I'll be sure to go even on the Facebook and put our information in there.
Yes.
And then encourage people about our event in January, and that she too is available to speak to groups and women's groups if needed. Yes, as well.
Yeah, and I forgot to record. So I told you, look, I'm learning. This technology stuff, man. I tell you, I didn't think my computer decided they wanted to update, so I had to go get my husband's computer right next to me. I said, "Oh Lord, not now, not now." So
it's okay. We did it.
We did it. It worked out. So thank you, ladies, so much for coming on and doing this, and thank you, ladies, for joining us here. We had a nice crowd.
Thank you, everyone. Thank you so much.
Thank you, and thank you to my daughters. My other daughter Danielle is on here too, so I got my two daughters too. Sally, I got two of them.
All right. All right. See you guys.
All right. Love you all. Take care.
Bye-bye.
Bye.